We're now joined by Dr. Mohammed Tahir. He's a trauma and nerve surgeon at FAJR Scientific. He returned from Gaza on Saturday and he's joining us live from London. Thank you very much for your time. You have been on several medical missions to Gaza. Can you give us an idea about the type of patients who are in need of these medical evacuations, some of the ones that you've seen, no doubt, and why this part of the ceasefire is so important?
Thank you very much for having me. There are a mixture of patients that need to be evacuated. There are those who are have been directly affected by war injuries due to shrapnel and bullets and so on, that have injuries that cannot be treated in Gaza. Firstly, because there's a complete breakdown of the healthcare system. You don't have appropriate tools, you don't have appropriate diagnostics. And as such, these patients, which include a lot of children, and some of my own patients, if not evacuated, are going to come to direct harm and have limbs amputated and so on. And in some cases, may deteriorate and die. So that's a real concern for me. And then you have another group of patients, for example, those with cancer. There are no, as I said, there are no diagnostics, there is no chemotherapy, there are no systems in place to treat patients with cancer. I have medical students who have very aggressive types of cancer that have not been able to be treated for months and months and months. And as I said before, those patients will die unless they're allowed to be evacuated. So it's very important, and it's crucial for the ceasefire agreement.
And it's, of course, as you're describing, it's a matter of life and death. Dr. Tahir, how would you describe a situation where, as you're saying, there are many people in Gaza, many patients in Gaza who aren't able to get the care they need only because of Israel's attacks on the Strip's healthcare infrastructure, and yet Israel also stops those who need to go abroad for treatment, that they're not able to get treatment because of the barriers that Israel has put in place?
In order to treat a number of those patients, you need to rebuild the facilities. That's going to take time. You need to be able to import very important diagnostic machinery and devices. Again, that's going to take time. You need to build the systems in place. You need to have the skill set set up and doctors allowed back in and so on. That's all going to take time. That's the time that these patients don't have. So that's why they need to be evacuated. Meanwhile, in a parallel system, you can then redevelop the medical system in order to treat the remainder of the patients, because there aren't 14,000 injured. There are hundreds of thousands of injured. And for the rest of the patients, they also need care. So these two things need to run in parallel. We need to rebuild the local system, allow importing of critical equipment and expertise, and at the same time allow those with the most urgent needs evacuated so that they can have their healthcare needs addressed.
And as we mentioned, you just left Gaza on Saturday. You've been on medical missions to Gaza before then. Have you noticed any difference in the healthcare facilities and the services that they're able to provide since the ceasefire began?
To be honest with you, from the moment that the ceasefire began to the moment I left, there was no appreciable change. In terms of medical care, we were still working with the same medications, with the same diagnostic equipment. Patients were still coming to harm because of a lack of access to healthcare needs. For example, those who have malnutrition, having other forms of nutrition, and those that need appropriate antibiotics, not having access to those that need diagnoses made cannot have diagnoses made because we don't have the scanners available. There's not a single MRI scanner in the entire Gaza Strip. When I worked in Al-Aqsa Hospital, when it was a major trauma center, we did so without a CT scanner. So those difficulties still exist, and there's been some importing of food. And I've seen tractors come in and so forth, but really that's no help to these patients who are in need the most, and who are most vulnerable, because a lot of them are children, and some of them are my patients that I've treated, as young as 9 or 10 or 11 or 12, who are suffering on a daily basis because they cannot get appropriate healthcare. So this is really, really important, and I really stress the importance of this. Have some compassion at least for these children who are innocent. They've done nothing wrong, and yet their whole bodies have been destroyed, and their futures destroyed with that too. So let's just be human about this and help them. This is the only thing that I'm calling for.
Dr. Mohammed Tahir, thank you so much for sharing your experience with us. We really appreciate it.
Thank you very much.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.